And then if you do miss, I can send that to you. Okay, and then Mike Birch, I'm impressed that you're calling in from London. So welcome. Mike was meant to stay with us last weekend on Friday night or Saturday night from the UK, and then didn't, since now I was calling in from London. Let me just see who else. Andy, I don't know, Andy C. You can unmute by pressing on the bottom left of your screen, or otherwise just write a note in the chat. It's easier. And then I see Brian.
Next, Andy's a friend of mine.
Okay. Hi, Andy. Welcome. Lovely to have you here. Hello, friends.
How's it, Max?
Okay. Okay. So I think, okay, well, it's past topper. So we'll welcome everyone. And I'm super impressed because I think somehow, like even these days when we're staying at home and we're all on lockdown, somehow we all seem to be more shattered by the end of the day than we are when we are racing around doing a million things. Maybe we don't have the same adrenaline, or maybe it's just the intensity of screens and screen time. I know I'm spending more time on screen. So I do feel very privileged to have you here. And I know how precious time is, even when we appear to have more time. So just to introduce myself, for those who don't know me, I'm Nicola. I'm a physiotherapist and a mum of 3 children. They're not so young anymore. Our daughter's 13 and our boys are 11 and 9 now. I've always had a passion for health and wellness, and my sort of real passion is empowering people to take control of their own health and wellness by connecting them more with their bodies and their body's wisdom. So I worked in the UK a lot in sports physio and spinal physio. I had a practice in Wimbledon, and then when we returned to South Africa, I did far more women's health physio. And then I've gone more into stress management and mindfulness and breath work. I teach courses at schools for parents and children, and then I do it for corporates, and then I do a women's wellness, I call it a feminine wisdom course, where I teach women breathwork and mindfulness tools, and then we talk about our menstrual cycles and our pelvic floors and all sorts of things like that. So I love it, and the women who come on it seem to love it. But my story is that I am in my 20s, early 20s, I was living and working in London as a sports physio, and I developed very bad eczema. Started as a small little patch on my forehead, and this dry patch, and it was spreading, so I went to go and see my GP, and he gave me a cream for it, and it worked wonderfully well. It took it away completely. And so I was very happy, and I just carried on, and then I stopped it. I stopped using that cream, and it exploded right across my forehead, and it was terrible. And so he then did patch tests for me, which are a whole lot of like sticky plasters down your back with allergens, different allergens, to see what was causing this allergic dermatitis, as he called it. And so the results came back, and I had a very allergic skin, and I was allergic to formaldehyde, which is a preservative, which when we were doing dissection in varsity, Karen, you'll know this, was from, like, the bodies are preserved in formaldehyde, but I mean, I didn't know that I was in contact with any formaldehyde, and there was a whole lot of other chemicals, which I also didn't think I was using. And then when I started to look at a lot of the ingredients in this soaps, in the lotions, in the shampoos, they all had it, this imidiazole, urea, and cocamidal propyl betaine, and all these things. And this preservative was in so many different forms and in so many different things, even to the extent, like, I can't buy a pair of jeans or a new shirt and not wash it. If I wear it, that dye, the dyes are all preserved in preservatives to look good on the shelves, and that really irritates my skin. So it was a huge awareness for me, suddenly realizing the chemicals that I was loading on my body, which I'd never paid any attention to before. So I went to go and see a Harley Street dermatologist. I went to see like the best sort of specialists, and all they could offer me were cortisone creams, which I used for a while, and then it would just come out worse. Eventually I had it on my arms, and then on my legs. And I tried all sorts of different started to really delve in much more into natural and alternative medicine at that stage, because Western medicine just had no answers for me. And thankfully, over time, that and with a lot of different treatment and using much more clean products and things, that really has settled. But when our children were born, I knew that they would have a genetic predisposition to a very sensitive skin like I had. And so I was very conscious about what I want to put on their skin and really decreasing their toxic load. And so that was part of our journey, and what really sort of started to awaken me more to this path of natural medicine. And then I just always longed for some sort of protocol, like when I saw our children getting sick, something that I could use to support their immune system, not to take it away, because building an immune system is like learning to walk. You're going to get sick and you're going to fall, and you have to do that so that you can actually learn to walk. You can't put a child in a walking ring and then so that you protect them from falling and then hope that they're going to learn to walk. They have to learn to fall. That's part of the balance. And the same with our immune system. We have to get sick to build a strong and resilient immune system. But I didn't want the secondary complications for the cold and the snotty nose to go into a postnasal drip, to go into a chest thing, and just to try and support them as much as possible. So I turned a lot to different supplements and homeopathy where I could. We turned to antibiotics when we had to. But I'd have this sick feeling when I saw them getting sick, because I kind of felt like this was this train coming towards me and I couldn't stop it and I couldn't support them. And I believed in the power of their bodies. Like, I didn't want to suppress a fever too much, because I know, and as we're all learning now with the coronavirus, that fevers are so important for helping to, because that's what kills the virus is a hot temperature. But at the same time, you don't want to see your child in huge discomfort and struggling to manage this fever and these high temperatures. So then I'd want to give Calpol, but then I would suppress the fever and maybe make this whole thing last longer, and maybe the virus didn't die off as quickly and easily. So I longed for it, and I felt this powerlessness when our children were sick. And I wish that we'd had these oils when they were young, which is why I wanted to tell you, because I know your boys are young, and these snotty noses and things are fine, but when it becomes ongoing or becomes something more. So I wish that we'd had these oils when our ones were little, but because I just find them, they're a tool to help uplift everything from boosting immunity and protecting to to a reactive, if they are getting sick. Like last night, everyone started to be a bit snotty and sneezy in our home and things. And I had tools and I could do it straight away. I put stuff on their chest and under their feet. And today everyone was so much better. And it's a sense of relief. It's not taking it away, but it's supporting them through. If they can get through this naturally and easily, then it helps them for that. So I've got notes because I'm very passionate about this, and I could talk for hours and hours, but we don't want to be talking for hours and hours. Please feel free to ask me. I talk a lot, but please feel free to ask me any questions and to interrupt me as we go. Okay, so the first important thing to know about these essential oils is that they are 100% pure and natural. So I'm talking specifically, the things I tell you about the oils and the different essential oils are the same properties for all essential oils. But what makes these different is that they have something called a certified pure therapeutic grade, which guarantees there are 54 tests done on every single bottle that doTERRA receives from their distillers and from their harvesters, or from their harvesters who go to their distillers, and that they receive to test that these are absolutely pure, that they don't have any contaminants or fillers or any synthetic perfumes or agents. So that's what's different, and that's why these are more effective often than other essential oils that we might have come to know about. So nothing's added and nothing's taken away. There's nothing that it's not diluted, it's not stretched to go further, there's no synthetic fragrances to make it smell stronger. And normally at this point in the class, when we're in person, I get everyone to have a drop of peppermint on their hands, rub it in, inhale it, and rub it on their neck and shoulders. And it is unbelievable how potent just one drop of of peppermint is. So everyone's always astounded. I mean, it can make your eyes water. It's one of those, whew, that's strong. And so this is just pure plant essence, and plants have been used as medicine since the beginning of time. A lot of our Western medicines are based on plant compounds or synthetic versions of the plant compounds. We always love having peppermint tea after our meal at night. So we will just pick mint leaves from the garden, put a handful of mint leaves in the teapot and just put hot water over it. And it's a lovely digestive. Everyone who comes for dinner comments on how much, like, it actually makes you feel not full, and it sort of soothes your stomach. But that mint tea is these peppermint drops are 50 to 70 times more potent than just the mint herbs. So they really are very strong. They've got 28 times the therapeutic value of that. So they're very pure, and they are all the herbs are sourced from the parts of the world where they grow best. So like the eucalyptus is from Australia, the tea tree is from Australia and Kenya, the lavender and the rose are from Bulgaria and France, because that is where the plants grow best. That's where their indigenous environment is, where they are indigenous to, and they have the strongest therapeutic values. So like the lavandin, which is the calming, soothing part of the lavender that helps to calm us, that's found in highest amounts in the lavender in France. Whereas, you know, we have lovely Margaret Roberts lavender in our garden, but if we had to really compress it and distill it and get the essential oil out of it, it wouldn't have the same therapeutic value. So doTERRA don't have their own farms. They don't have big farms in the States or anywhere all over the world. They are actually, they talk about building farmers. And so it's important to tell you that as a physio, I started sharing and using these oils, and I loved them for myself. And then I started sharing them with my community, the ladies who came on my feminine wisdom course. At the time, I wasn't teaching classes. Dom taught a couple of classes. And these ladies loved it, and they bought their kits and they started using it, and I started having really good feedback from all of them, and I started sharing it more. And I decided in about mid-August last year that as a health professional, if I'm going to be telling people about these oils and sharing them, it's my professional responsibility to really know where they're from, where they're sourced from, more about the company, the ethics, the sustainability, the purity, checking out their all the claims. So at quite last minute, I went off to Utah in the States to their big convention. There were 36,000 people there. I had no idea that this was that essential oils were so huge. And I was blown away, because I was kind of skeptical and a bit dubious whether this was going to be a bit of a rah-rah, huge bands and motivational speakers, but not a lot of substance. And it was quite the opposite. There was a huge amount of substance. There were some of the growers and distillers from all over the world. There were people who called, who were videoed in and live streamed in. There's a huge amount around the research, around there were representatives from the plant research companies, which are independent companies, and plant research universities, who talked about their research and their testing and things. So again, I could go or tell you for hours, but doTERRA have a program called Co-Impact Sourcing, and it really is a model for empowering the small farmer. So we know very well in South Africa, the small farmers, the small rural farmers. We know how, my father-in-law is a small farmer, and he's not really a small rural farmer, but I know how hamstrung he is by his buyers. They'll set the price, they'll tell them when they're paying, he's very hamstrung by them. Whereas doTERRA guarantee the price up front, they pay on the day, they help to really empower these small farmers. And there are countless stories about this. One example was a Kenyan woman who we only saw her picture. There was another, actually a pink peppercorn picker. from Kenya who was there in person, and he'd been there for the second year. So that's another story. But this farmer, there's a photo of her holding her first tea tree crop, and she was smiling very proudly as she held this crop. And the next photo was her and her family when she'd been told how much she was going to be paid for this crop. And it was incredible and heartwarming to see how happy they were that this was now going to be supporting their family. But this woman doesn't even own her land. So she has got no security for future or for her family. But what doTERRA do is they set up an incredible sort of payment plan. So she's still getting paid, but some of that money will be set aside, and over 3 to 4 years, she'll be able to have bought that land. They've secured that land, and she'll buy that land, and that will be her land, which is incredible and very heartwarming for me. And I think how business should be done. And I think it's the doTERRA talk about blessing on both sides of the bottle. So they're blessing the people who are using their oils, but also the farmers and growers and distillers. And that was a huge focus of that. So as I mentioned, every bottle that they receive, they don't just sort of, once a farmer has been shown to have pure plant, their oils to be pure, they don't sort of get a tick and now we always accept from them. Every batch that they receive is tested 54 times, which is 43 in-house and 11 external. And on the bottom of every bottle is a code, and you can look this up on the website called Source to You, and you find out where it's grown, when it was harvested. You find out all about that specific oil. So it's very, very traceable. And the combination of this incredibly pure oil, and why it needs to be pure is because the plant oils are compressed to such an extent that if there are any contaminants like fertilizers, like pesticides, anything like that, you're then highly compressing and concentrating that too. So then it can become quite toxic, because it's one thing if you're just distilling just plant essence, but if you're distilling anything else and concentrating it, it can really be quite dangerous, because you don't know what's in it. You're highly concentrating whatever else is in it. So this purity and therapeutic value now guarantees what's in every single bottle. Every single bottle is exactly the same, like every single Panado is exactly the same, like every single microdose. So you can suddenly do research on it. So you can do clinical trials and clinical studies. And then Johns Hopkins University 4 years ago adopted doTERRA essential oils as their control for doing any studies around essential oils, because of this guarantee of purity and potency. Another, as I said, one of the focuses for the convention was all the medical collaborations, which was very exciting for me. I'm on a Facebook group which is for medical practitioners globally who are using doTERRA oils for themselves or also for their patients. So one of the examples is this Prime Meridian Healthcare. These are actually health clinics that have been set up, which there were 3 at the beginning of last year. Now they're in the process of building another 30 of them. And these are run by they have board certified physicians working in the hospitals, and they are able to use allopathic medicine and essential oils. So let's say you have needing a hip replacement. Obviously you need to have the Western medical expertise and technology to do that, but that you will then use essential oils to help with dealing with pain and inflammation and promote healing and wound healing, things like that. Also, people come in with different things like asthma. They might be prescribed first essential oils, a prescription there, but they can also prescribe the allopathic medicine. There's also a new oncology center that's meant to be opening up in September this year. I think it'll probably be delayed, in Mississippi, called St. Elizabeth Healthcare, by St. Elizabeth Healthcare. It's a huge oncology unit. It's like a pioneering one. And they have incredible, they've got an incredible center. They're going to be teaching yoga, mindfulness, classes on using essential oils, cooking classes, how to cook healthy food and things like that. And I've actually been chatting to an oncoplastic surgeon here in Johannesburg, and he was saying that he knows his patients are going to be looking for alternatives to help them through their cancer their chemotherapy and things like that, for things like skin issues and for sleep and for anxiety and stress. And he would rather they were using something like this, which he knows there's research in it, and he knows that there's so much more around drug interactions and side effects, that he knows what his patients are using rather than them looking elsewhere and he doesn't know. So there's another health insurance company in the US called Blue Diamond, and they offer $250 for doTERRA essential oils as part of their medical aid benefits because of, again, the purity and the potency. So I think it's becoming recognized far more as a medicine, and there's so much actually on publications such as PubMed, which are mainstream medical publications on essential oils and the effectiveness and a lot of the research around that. So I'll tell you a little bit more about that as we go tonight. So the first thing is that they're 100% natural and pure and potent. The second thing is that they're as effective, and if not more effective, than some of our modern medical approaches, which seems like a very big statement to say, but I'll tell you why. So this is very, very basic biology 101, but our cells are covered in an oily cell membrane, as our plant cells are covered in this oily plant cell membrane. And the oily membrane is what protects the plant's cells and protects the plant from pests, from disease, from any invasions. And that's the same with our cells. Our membranes protect our cells and allow our barrier, which and a membrane that allow things to go in and out of our cells or stop things from going in and out. Now, viruses sit more inside the cell and bacteria sits outside the cell. And most of our modern medicines like antibiotics are water-based. So water and oil don't mix. Water can't permeate oil, as we all know, like when you put a boiling water and a little bit of olive oil on top, the oil's separate from the water. So that's why a GP might, when they prescribe antibiotics, say this is only going to help if this is a bacterial infection, because if it's viral infection, it won't be able to, because it can't permeate through that oily cell membrane. Now, essential oils are oil-based, so they can permeate, because the like can permeate through the like. So it doesn't matter whether it's viral or bacterial, the essential oils can still be incredibly effective. And they don't come with the side effects like wreaking havoc on your gut, any addictions, any effects on your hormones, or knocking out your immune system or suppressing anything. So as I said, our children have had antibiotics in times when they were much younger and when they needed it, but I'm not sure that we would have needed to go down that route if we'd had these oils as often or when we did. And yeah, one looks at the list of side effects in medication, often it takes us a while. The medication helps us to recover from the illness, but then we have to recover from the medication. So, and we see even with this, all the discussions about whether we should be using ibuprofen when we have something like corona, because it suppresses the inflammatory response, and we actually need our inflammatory response to help us at this sort of time. So that's just a little bit on that, and the essential oils are extremely fast acting. They, again, a lot of the research around this is showing us all this, and it can permeate into the bloodstream within 2 minutes, and in 20 minutes can be found circulating throughout the body, which is actually quite astounding. Any questions? Okay, so the final important thing to know is that they are less expensive than traditional medical care used in the long term. An example of this is if a child gets an earache at 7 or 8 at night. I mean, it always happens at night, or when you're on a farm, or when you're far from home or on holiday, and they start to get a sore ear. The best you can do, usually with our Western medicine, is give them maybe some Calpol, or let it settle, and then when the the next morning can phone the doctor, take time off work to take them to the doctor, don't send them to school. Then we go and pay for the doctor, go to Dis-Chem, get the medication, get home, settle them, and then go off to work or stay at home. With something like the oils, they're incredible protocols like lavender and melaleuca. So the lavender and melaleuca, which is tea tree. So you can put a drop of each or 2 drops of each around the ear with a little bit of coconut oil. And it's incredible for helping to settle earache. So by the next morning, you've now had a 12-hour head start. By the time the next morning comes, I've had actually I've told the story in a number of classes, and then have had a number of people phoning me and saying, well, actually exactly the same thing happened with our children. I did that. I remembered you told us that, and we put it around their ears, and it really nips it in the bud and settles very quickly. So you're not having to go off to the doctor the next day. You're not having to then take time off work, pay for the medication. And these same 2 oils help to treat all sorts of skin stuff, grazes, wounds, cystitis, sunburn, things like that. If anyone else in the home then gets sick, you can use the same oils to treat mum, dad, nanny, granny, even dogs. And so it's incredible or pets, how versatile the oils are and how fast acting. So a small bottle like this has got 85 drops in it. The larger bottles have got 250 drops, and they go a long way. So a kit like of this we call the family essential kit. So the doTERRA used to call it the family physician kit, and they really want to encourage a healer in every home, which is the mother or the health, someone to be able to have the main tools to help to treat their family with 90% of illnesses with the kit like this. And that kit should last you at least 3 to 6 months. And then you don't have the side effects of havoc on the gut or any addictive issues or anything like that. Okay, so there are 3 main ways that we use these essential oils. The first one is aromatically. Now, aromatically, we kind of all think of like burning them in a little diffuser, and it's just a soft thing. It's not going to be very effective. How we actually do it aromatically is either using a water-based diffuser, like something like this. I've lent out one of my other diffusers in the other ones next to my bed. So where you put water in and you put a few drops of whatever oil you're diffusing, you can do it like that. Or you can even just smell it straight out of the bottle. And we call this a ghetto diffuser, or putting a drop on your hands and inhaling. That's also a ghetto diffuser, just inhaling like that, or from a little roller bottle. And that might seem very sort of soft. That's not going to be very effective, but it's important to remember how connected our olfactory nerve is, which sits here, to our limbic system, which is right just at the front of our brain. It's very, very connected. And we all know that when we have a smell that suddenly reminds us of our childhood, how these memories come flooding back very instantaneously. Our smell is very strongly connected to our emotions. And so it can really help us to interrupt some of our repetitive thought patterns when some of our good oils for anxiety helps to break those patterns and helps to calm our limbic system. And also when we have an anesthetic, the way that an anesthetic is administered is through the nose and mouth. We put a mask over our nose and mouth, breathe in and count to 10. And by the time we reach 10, we're out for the count. And that's because our lungs are so highly perfused. As physios, Karen will also know that the job of the lungs is to distribute oxygen around to every part of our body as quickly as possible. So when we're inhaling these essential oils, they get distributed actually quicker than when we're putting them on our skin, and they can be distributed unbelievably quickly and effectively to the rest of our bodies, which is what happens when we have an anesthetic. So that's the first way, is aromatically. And so just examples of these are like children who struggle with asthma or breathing things. You can put a little diffuser next to their bed and put some breathe essential oils. And I'm going to take you through each of the oils in a moment. But that helps to open up airways. And it doesn't the wonderful thing with essential oils is it's not either or. It's not like, oh, I'm now using essential oils, I can't use my asthma inhaler. It's not like that at all. The asthma inhaler is absolutely fine. You can still use that, but hopefully by using the oils, you'll need the asthma inhaler less and less, because you're building up the body's own capacity and the body's respiratory capacity. So, or like, as I said, everyone felt a bit snotty yesterday. And so I also put a diffuser with On Guard and Breathe. And that's also, we just had that going in some of the rooms, and that seems to have really helped. So the second way you can apply these oils is topically. So that would be directly to the skin. So an example is like lavender essential oil, like a burn. You'd literally take off the top, turn it over, and just put it directly onto the burn. And it's unbelievably effective at helping to decrease the blistering and the, Jill, I think you had an experience of a burn, was it you? Yeah, and how effective that was at settling that burn. So, so some of them we put on neat. With children, we usually dilute it. I didn't bring it down, but I have a little jar that I put with normal coconut oil. This is organic coconut oil from Dis-Chem. I mean, from Woolies or from Dis-Chem. And I'll put like a little bit of coconut oil in my hand, and I'll put like a drop of lavender and a drop of tea tree or melaleuca. If children are sunburnt, as an example, rub it on my hands, put it on shoulders, or any of the sunburnt areas, and that helps to settle it very quickly. So topically like that, or we make rollers. So I carry this little bag around with me wherever I go, and in the roller you put 15 drops. So this would be for adult, or for our children is fine, the age of our children. For younger children, you'd do it far more diluted, but you'd put like 15 drops of whatever oil it is that you're wanting, and you fill it up with what we call fractionated coconut oil, which is coconut oil with the fat taken out. So it doesn't coagulate like our normal coconut oil, and it's very easily absorbed. And why we use it with coconut oil is firstly because essential oils are very volatile. You know, they can evaporate very quickly and easily. So you want it to actually be absorbed, which the coconut oil helps it to bind and to absorb, and dilutes it a bit, because otherwise they are very potent, as I said. And yeah, it allows it to absorb easier. So where we would apply these rollers is actually a lot to the bottom of the feet, because our feet have the least oily membranes. Sorry, they've got the least skin oils, least natural oils that we have on our body, and they've got the biggest pores. So the oils are absorbed far more quickly and easily through the feet than through other areas. But I also often put them on pulse points, like on throat, especially if anyone's getting a sore throat. Put them here or here. I make a mixture called Calm for my ladies on my Feminine Wisdom course, which is a combination of lavender, peppermint, and frankincense. And this one we use as like a perfume, and so put it like that, and I encourage them to smell it out the bottle or put it on their hands and take deep breaths in, put it on their feet when they're needing to. So there are all sorts of different mixes we can make and different ways we can use it. So that's topically. There's something else I was going to think about saying with the coconut oil. Anyway, yeah. And then the third way that we can take these oils is actually internally. And it's not just safe, but it's actually also recommended because of this certified pure therapeutic grade. Now, most aromatherapists would have a heart attack. They'll say you must never take oils internally, which is absolutely right, because of exactly what I explained earlier. There's no governing body for essential oils. There's no FDA checking. When in a pharmacy where it says 100% lavender or 100% pure, 100% organic, there's no one checking. There's no one checking that it's 100% pure. You can just put whatever you want on labels. And so if we had something that wasn't pure and we take it internally, then it is actually very dangerous. So But like this lemon essential oil, it takes 45 to 50 lemons to make just this one bottle, the bigger bottle of lemon essential oil. And so this, I put a drop of lemon in my warm water every morning and drink that. And I'll tell you why just now when we go through the oils. So you can put it in warm water. You can put a drop directly into your mouth, often followed by water because they're quite pure and potent. Or you can drink it in a little bit of water, or you can make what we call these veggie capsules. So I didn't even know about these until I started using the oils. You can get them from Dis-Chem or from health shops. You can get more pure veggie caps. And these are little empty capsules. And so you can mix the mixture you're wanting of the ones that are safe for taking internally. And you can put the oils with a little bit of olive oil or coconut oil as a carrier. And you keep it in a little bottle. And then we use a little pipette like this. And you can open so once you've made your mixture of what oils you want, open it, put this little capsule, put whatever oils you need in the capsule, and then close the capsule. I've just dropped the lid of the capsule, which won't happen to you when you do it, and you close it, and you can take that as a tablet, as your own capsule. And again, there are people, even on our group here in South Africa, who children have had such ongoing issues, and they've had ongoing issues, allergies or gut and digestive issues, and have found enormous benefit and enormous help with taking some of these oils internally. One of our leaders' children was on level 4 antihistamines, which are hectic, and they've been able to get off so many of their schedule for drugs by using the oils, which is so heartening to know. So that's the basics of the oils, and I'm going to now just talk you through each of them. Any questions so far? So in this kit, so we'll start off with peppermint. So peppermint is a really good oil for decreasing bloating, distension, any gastro and abdominal stuff. So like I said, it really helps to settle the stomach, which helps with digestion. It's a cooling oil, so it's very good for hot flashes, for fever, for keeping fevers more manageable. Again, it's not going to suppress the body's immune response, but it's going to help to cool the body slightly and keep one feeling a little bit cooler. It's good for headaches and neck tension. I've got a little peppermint roller that I keep with me. Here we go. So if I'm feeling a headache coming on, or spending a lot of time working or at the computer, I'll put a roller like that or put it across my forehead. If I'm driving long distances, I'll do this too. Sometimes I'll smell. You can even put it on your hand and lick it. It's a bit of a like pick me up, wake me up sort of thing. If it's a child or feeling headachy or with fever, I'd put it behind the neck like that, or up and down the spine, as I said, under the feet. Many women when I'm when I was in the US were saying how peppermint had really helped them with their hot flashes. So it's also good for digestive stuff. You can put it just down like where your trachea and esophagus are, or around the stomach, and even into the belly button for helping to calm the stomach. So I've got a little card here which we give to everyone who gets oils as a reminder, and I always look at it because there's always something that I leave out when I tell people about them. So cooling, head tension, so it's for headaches. Energy, so it's pick me up, it's brilliant for focus and attention things. Can be used with lemon as well for focus and for studying. One of my friends had bought the oils, and her son was studying from a trick last year, so she put on the diffuser, she put some drops of peppermint and some lemon with him while he was studying. He's like, oh mum, really, what are you doing? And he was very skeptical, you and all your silly stuff. Anyway, the next day she said to him, do you want me to do the diffuser again or not? And he's like, yeah, I think you can do it. That would be. So yeah, peppermint's very good for focus, for energy. And then there's a combination of peppermint, lemon, and lavender, which are incredible for seasonal threats, for allergies. So they are very good for decreasing our histamine response. I've had a lot of friends who've been using it who find with sinus stuff that they put it on in the mornings, breathe it in, or make a roller. Also, you can take these internally in a little capsule if you really struggle with hay fever. These are very powerful anti-allergy oils. So that's peppermint. So then we may as well talk about lemon. So the lemon it's a very strong oil for drawing stuff. It's very strong detoxer. So when we have a drop of lemon in warm water, before we ingest lemon, it's very acid. It's got a pH of about 2.2. Once we've ingested it, it becomes quite very alkaline, and so it goes to a pH of over 7, 7.5, even up to 9. And so it helps to alkalize our bodies, which is why it's pretty much standard advice to start the day with lemon and water. But the only problem is that when we squeeze normal lemon into water, it has citric acid as well. So it takes the enamel off our teeth, which is why dentists aren't mad about this whole lemon and water thing, or they say you must brush your teeth straight afterwards. So I put a drop of this in my warm water in the morning. I'll also put a drop in my water bottle and literally one drop in a whole water bottle that I'll take around with me all through the day. All the citrus oils are very uplifting. They're very good for mood. They're very good for sort of antidepressants for lifting mood. So, but they draw and detox very strongly. So you would only use glass or stainless steel to have anything lemon or citrus in, because it would actually draw all the plastics, the BPAs out of the plastics, which would mean that you would be drinking them. It's that strong. It actually deteriorates the plastics. So but that's why it draws anything in our digestive tract, and it helps to get rid of toxins in our bodies, in our kidneys and liver. So a friend of mine started using the oils, but she just bought one. She was in Australia and she just bought the lemon from a health shop first. She hadn't bought a kit, and that was all she was using. And she said she was mad about it. She was putting a drop in her water, and then she also made a hummus. She put a drop in her hummus. And she said to me, it's the most remarkable thing. My stomach is so much better than it's been in ages. And that's because it helps our digestion and helps with our body getting rid of toxins. So it's also good for cleansing and cleansing. So I've made a bigger bottle with 5 drops of lemon and a little bit of vinegar and mostly warm water. And I use that as our sort of natural cleaner for our surfaces. It's very good for getting off sticky stuff like chewing gum or press stick that's gone into car seats or clothes or things like that. Sticky marks from plasters and labels and all that sort of thing. So it's cleansing, detoxing, digestive health, and seasonal threats is lemon. So and we love it in our G&Ts as well. And then after the G&Ts, if you've had too many G&Ts the night before, it helps us to recover because it helps to detox. Okay, so then the third one of the allergy set is the lavender. So lavender, we all know, is very calming and soothing. It's very helpful for stress and anxiety. It's helpful for calming and soothing us emotionally, but also physically. So it helps us with sleep. It helps us with anxiety. It helps us with burns, skin issues, anything like that. There's a lovely, this is just one of many, many, many articles about lavender on PubMed. This one is the effect of lavender scent inhalation on prevention of stress, anxiety, and depression in postpartum period. I just chose this one because it's quite a simple one. So 140 women were admitted to an OBS and gynae unit, and postpartum they were split into 2 groups. One group was the control group, and they just had their normal postpartum interventions, the routine care. And the second group had to have their intervention with aromatherapy, consisting of inhaling 3 drops of lavender essential oil every 8 hours for 4 weeks. So this is 3 drops every 8 hours for 4 weeks. After 2 weeks, 1 and 3 months of delivery, the women were assessed on the 21-item DAS scale, which is the Depression, Anxiety, and Stress scale, which is very commonly used by psychologists, and the Edinburgh Stress, Anxiety, and Depression scale. And the results showed that the mean stress, anxiety, and depression at the time point of 2 weeks, and stress, anxiety, and depression scores at points of 1 month and 3 months after delivery were significantly lower in the study group compared with the control group. So the conclusion was inhaling the scent of lavender for 4 weeks can prevent stress, anxiety, and depression after childbirth. So that's quite astounding. So there's other ones on how it compares with the with diazepams, and that it actually was as effective as diazepam over a couple of week period. I actually don't have that one with me, but there's a lot around lavender and helping it to soothe and calm us without the side effects of a lot of the other medication and drugs. So calming, good for sleep. So spritzing a pillow or putting it directly on before sleep, or putting it in a diffuser next to the bed before sleep. For stress, like I say, I make that little calm roller with the lavender, mostly lavender, bit of peppermint and frankincense. That's all very grounding. Seasonal threats for the allergies, and bug bites. So very good for bug bites. Like I said, burns, skin issues, a lot of skin issues. So then actually talking about skin issues, like I mentioned earlier, the combination of lavender and tea tree is very potent for ear infections. It's also very potent for any skin issues. So things like acne, rashes, grazes, we make a spray, like in a little spray bottle like this, which we call an Aoi spray, which is 10 drops lavender, 10 drops melaleuca, which is the tea tree, and 10 drops of frankincense. And that's amazing for grazes, for cuts, for wounds, for also, like I said, for cystitis, you spray it in the area. For itching or burning around when you wheeze, you spray it in the area, and it's really good for helping with any like getting nipping infection in the bud. So even a drop of melaleuca, if you're prone to bladder tract infections, just a drop in one's underwear each day helps it to keep that at bay. So it's very good for any viral infections, like the gunky things that also, so viral stuff like that's going around now, but even sort of the viral thing on feet, like athlete's foot, or gunky stuff on toes, that you can literally tip over, put it onto the sore area, cold sores, tipping it over and putting it directly on, or you can add a little bit of coconut oil. If one had to put an oil on and it felt very hot or burny, or maybe you got a little bit in your eye, or something like that, or a child says, oh, that's hot, because some of them, they are very potent. You wouldn't add water to it, because again, the water and the oil don't mix, so it would almost drive it in. You'd actually add coconut oil to it, and it dilutes it with the coconut oil. So you just add more coconut oil. So if you got it in your eye, you'd use a bit of fractionated coconut oil or other coconut oil and just smear it around your eye, and that would very quickly dilute it. And the same with, like, if you put it on your cold sore and you're like, oh, that's a little bit burny or something, and you just dab it, your finger in some coconut oil. So I mean, little things like a drop of this in one's bars of flowers makes them last longer, but mostly it's for skin irritations. Yeah, for eczemas, the lavender and melaleuca is what we start with treating it. There's more oils that you can add if the eczema is more severe, but this sort of thing really helps with most skin issues, pimples, blackheads, yeah, all sorts of skin irritations like that. Sinus and immune support, it's a very, very big immune boosting oil, and I'll talk a little bit more about that later. And then healthy scalp, it's also very good for like things like cradle cap, dry scalp. So you could put a drop in your shampoo to help with any scalp things. Also, like our daughter started getting a sty in her eye, and I have a little roller so that I keep with lavender and melaleuca, and that we just rolled around her eye. So the sty is on her eye, but we just rolled it around her eye. And by the next day, it's like a non-event. It didn't develop into anything. So that's melaleuca. Then there's oregano, which if I got you to smell, smells very strong. It's like this very strong oregano pizza sort of smell, but this is a very, very hot oil. It's so if you had to put that directly onto your lip, it would actually burn. But this is our very strong, like antibiotic, antiviral oil. This is like what if someone is getting sick, we put it under with a bit of coconut oil under their feet. We may put it in a roller, which I'll tell you a little bit about just now as well. So an example there, not about a month or two ago, my husband was starting to get a sore throat. And he said to me, what's that strong one? Which one's the antibiotic one? So I said, no, it's oregano. You can just put a bit under your feet. So he put a bit under his feet, but he thought he'll also put a bit around his throat. So he wrapped it around his throat. Mike, you'll laugh at this. He went to bed and I was still in the bathroom. The next thing he says, "Yeesh, what was that?" He comes through, his whole neck is like red. It's where he's like rubbed this oregano in on. Anyway, we put some coconut oil on his neck. He could not believe how hot it was. And it was literally 1 or 2 drops that he had rubbed on it. You know, the sore throat was gone, or otherwise he just never complained about it ever again. But it's a very powerful immune boosting oil. Another use for it is skin imperfections, so like warts and geriatric warts and you know, some of our skin tags. You can, so Dom, who introduced me to the oils, tells the story of she developed this little skin tag on her forehead, and she went to go and see the dermatologist, and the dermatologist said it was a geriatric wart, and the only thing she could do was to burn it off or to freeze it off, but that it might leave a scar. So Dom decided that wasn't a great option right in the middle of her forehead, and she'd heard about this, so she thought she'd try it. And so literally in a little bottle like this, she used 2 drops of the oregano and then the rest coconut oil. And then she put it by her toothbrush, and then every day when she was brushing her teeth, she literally just turned it over like that and dabbed a bit onto her forehead, just right onto the tag. And she said after 10 days, it had made absolutely no difference. It looked exactly the same, but after 2 weeks, it was gone. She couldn't, it like disappeared there. And we've had, again, so we tell that story, and quite a few people say now they've used it with their kids with different warts on their knees. They'll put on a bit of cotton wool and put it over, like with a little bit of plaster over the wart, because you might not want to put it directly on a child's skin, and put it over every night for 2 weeks or 2 to 3 weeks, and it really is effective at getting rid of those sort of skin imperfections. You can also use it as an immune support, but also in your cooking. But I would put a little jar next to your stove, fill it with olive oil, maybe do then 2 or 3 or 4 drops of oregano, and then use a little pipette like this to literally put a mixture of the olive oil and the oregano in. Like putting 1 drop of oregano in is probably too strong for your meal. So that's oregano. And then you just keep that out. Okay, and then the last pure oil is frankincense. So the 3 wise men knew what they were talking about when they gave frankincense to baby Jesus. It's probably what's our most valuable oil, that and rose. They say this is the king of oils and rose is the queen of oils. And frankincense is hugely powerful at skin cellular regeneration. So I also have some research articles I want to share with you here. Yeah, so I have a bottle next to my my toothbrush as well, and I put a drop of frankincense under my tongue at night. I first came across frankincense when I mean, other than just hearing about it in the Bible, but when I was watching the series a few years ago called The Truth About Cancer, which is a series by Ty Bollinger, where he interviews people and various health practitioners working with different ways of treating cancer. Some of these people had done mainstream ways and then gone to alternative. Some were combining both. Some were only alternative. And something that came up time and time again was frankincense. And so I'll just read you a little bit. So he wrote an article recently about the anti-inflammatory and healing power of Boswellia serrata, which is frankincense. And so it's a lovely article, but he says frankincense was considered to be amongst the highest valued currency traded throughout the Middle East. It held value so immense that the high priests of Israel would burn it as the most precious sacrifice to God. He goes on to talk about where it's derived from and what it is. It says the boswellic acids found in frankincense resin are also powerful pain relievers that actually work better than non-steroidal anti-inflammatory drugs such as aspirin and ibuprofen. And unlike those, it doesn't disrupt the glycosaminoglycan synthesis, which is the process whereby body uses simple sugars to regenerate cellular tissue. He goes on to say the different uses can be for things like gas, constipation, irritable bowel syndrome, cramps, and other forms of gastrointestinal comfort. Colds and influenza, because it helps with inflammation and the coughing, phlegm, and other common symptoms. Inflammation and pain, compromised immunity, balanced or damaged hormones, poor sleep. So this is it's a tree oil. Frankincense is from the Boswellia trees, and tree oils are very grounding. Like citrus oils are very uplifting, tree oils are very grounding if you think of the energy of trees. So it helps with sleep. So we do lavender and frankincense together to really help sleep. And then finally, he says cancer and the side effects of chemotherapy. Perhaps its biggest claim to fame, frankincense oil has been shown to treat multiple forms of cancer, including ovarian, breast, and skin cancers. A compound known as AKBA is one component of frankincense oil in particular that studies have shown effectively combats cancer cells and prevents them from spreading and metastasizing. This includes cancer cells that have developed resistance to conventional cancer treatments like chemotherapy. So this is an article he published in 2019, November 2019. And then this one is a PubMed article, which is about Boswellia sacra essential oil induces tumor cell-specific apoptosis and suppresses tumor aggressiveness in cultured human breast cancer cells. So this is a more scientific article, but it goes on, the conclusions are, similar to our previous observations in human bladder cancer cells, Boswellia sacra essential oil induces breast cancer cell-specific cytotoxicity, suppression of cellular network formation and disruption of spheroid development of breast cancer cells by Boswellia sacra essential oil suggests that the essential oil may be effective for advanced breast cancer. Consistently, the essential oil represses signaling pathways and cell cycle regulators that have been proposed as therapeutic targets for breast cancer. Future preclinical and clinical studies are urgently needed to evaluate the safety and efficacy of Boswellia sacra essential oil as a therapeutic agent for treating breast cancer. So it's really powerful for cell regeneration. So it's very good for wrinkles, for helping us with glowing skin, for scars. So I also put a drop in my oil at night, my night oil, and put it on my face. It's very good for aches and discomforts. So for things like arthritis. It also boosts every other oil that it's combined with. It sort of up levels the other oils. So if you use it, like I said, with lavender, it makes the lavender work even more effectively. Let me just check what else. Oh, head tension. You see, I always forget if I don't look at. It's a lot of migraine sufferers use this. It's amazing for helping to treat migraines. So you take the lid off, put it onto your palate at the first sign of migraine, and then most people either use peppermint oil or deep blue, or there's another oil which is a combination called past tense. And if that doesn't settle the migraine in the first 15 minutes. You then do it again 15 minutes later and repeat it up to sort of 3 or 4 times. And actually, I had a woman come to one of my classes recently. I think it was my last class before lockdown. And she was a South American woman, and she didn't know that you could now get doTERRA oils here in South Africa. She's been getting them for the last 2 or 3 years from Brazil. And she said she'd resisted using them for so long. Her aunt had told them, and she wasn't that interested. And then her cousin started using them and raving about it. So then she thought, okay, well, maybe she must see. And she said she's been dependent on migraine medication since she was 15. She's suffered terrible migraines. And she has medication for it. But when she takes that medication, she has to have food and she has to have coffee with it. And so it's always a palaver. And if the migraine starts at night, she can't be bothered to go downstairs and prepare food and get herself. And she says this has been a complete game changer. So she's been using it the last 2 years, and she does exactly that. And she hasn't struggled with her migraines at all since using this. So it's interesting to hear. I mean, I luckily don't, so I don't have personal experience with that, but people who have said it's really helped. So those are the 6 pure oils. Those can all be taken internally, but they're potent. So you literally just take 1 or 2. I'd never use them internally for children unless in a capsule, but I would also be very, I think, topically and diffusing are definitely the first approaches for children and probably for adults too. And then if something's more chronic, to take internally. And then there are 4 blends. So the blends take a whole lot of the most highest therapeutic values and put them together. So the first one I'll talk about is Deep Blue. Now this actually comes with a child-proof lid. So this one you can't ingest. This has got, I mean, to me, this as a physio, I love the smell. It's like the wintergreen smell. It's unbelievable at helping with bruising and inflammation, putting it either directly on the bruises or directly onto like a swollen or sprained ankle helps to settle it very, very quickly. It's very good for inflammatory stuff and things like arthritis. So we sometimes combine it with frankincense. You can make a roller. Again, all our kids have Deep Blue rollers. I've got one here. So it actually looks blue. It's got this blue tinge. So this has got 15 drops of Deep Blue and the rest fractionated coconut oil. We put that, if we've got neck tension. I was also, so someone had asked on our group this morning, today, about her husband's got a hectic tension headache. And so we were saying about combining Deep Blue and frankincense and putting it, and I often find applying to the front of your neck, we call the sternocleidomastoid muscles hold a lot of our tension, and especially our emotional tension. And so applying it to there or rubbing into these muscles and then rubbing the back of your neck. As I said, it's very good for bruises, any inflammation. Putting it in an Epsom salts bath after like a run or a half marathon or a marathon really helps. Let me just see what else. Yeah, so soothes sore muscles for head and neck tension and bruising and inflammation. So that's Deep Blue. And then Zengest is a digestive blend. So this has got everything. It's got aniseed, peppermint, ginger, caraway, coriander, tarragon, fennel, limonene. So this is that sambuca smell. It's that that licorice fennel kind of smell, and it's one that actually a lot of people start by these oils by using this because it's incredible at taking down bloating. So literally a drop on your hand and then rubbing it on your stomach helps to decrease bloating, or putting it in a roller like this and then rolling it in a clockwise direction around your stomach and into your belly button. Our belly button, remember, is where our umbilical cord came into. So we have a lot more, it's highly perfused area. So when we put any oils in our belly button, it's very quickly distributed. So under feet, and it just helps to return the body to homeostasis. So it helps to break down mucus. So when we've also overindulged in dairy or things like that, it's very good with helping to settle the stomach. Also, when so it doesn't matter if it's diarrhea or constipation or bloating, it just helps to settle. So that's why I keep this with me in my little bag, and on the way to school, if someone's got a sore tummy, then you're like, oh, now what do we do? You've got a sore tummy and I'm about to drop you at school. So I will then say, okay, lift your shirt or lift your dress and put it on your tummy. And then I send them with this in their blazer and say, if it's still sore, go to the bathroom and put it on. And if you still need me, then call me. But at least I'm leaving them with something, and I'm not also having to turn to giving them something like a Buscopan straight away when maybe it's just anxiety, or maybe it's just a passing sore tummy. And this really helps to settle, but it also helps to empower our children that they've got tools that they can use. So this is one that you can also take internally, putting it in a little drop in a shot glass of water and drinking that really helps to settle a sore stomach. Or making a little veggie capsule if that taste is too strong for you. It's also very good for motion sickness because of, again, the ginger and everything that's in it. And finally, because it's good at breaking down mucus, if we've got very congested sinuses, very blocked sinuses, this is actually quite a nice one to rub around onto your sinuses, and it helps to break down that mucus, helps you to breathe more easily. So that's, and very good for colicky babies, crampy tummies, all that sort of stuff. Reflux, heartburn, any of those digestive issues. So digestive support, indigestion, and motion sickness is what's on here. And then just two more, which are probably the two most important at this time. This first one is breathe. So this is the one for opening up airways, for helping us to breathe more easily. I've got a roller of this as well that we roll on chest and under feet. Remember, like the old tricks also for coughing that we used to put Vicks under feet. This also putting breathe under feet or on chest, a little bit under the nose. You can also make your own sort of salve by putting thicker coconut oil in here and putting sort of 10 drops in here, mixing it depending on, okay, for younger children, we send a dilution chart to tell you how to dilute, but you'd put that on their chest or under feet. Breathe is also good for snoring, helps anyone struggling with snoring because it opens up the airways, good for that persistent cough. We were on a cycle tour, and I took it with me just to open up my airways and help me to breathe. And I was putting on my chest, and it was a whole group of people. We didn't really know them. They were from all over South Africa and Prince Albert. It was lovely. The Karoo gravel grinder. Anyway, and one of the farmers from McGregor said, "Oh, what's that?" So I told him, and he's like, "Oh, I want to try." And he put it on his chest, and I think he did it twice in a day. And the next day his wife said to me, "Geez, I don't know what's in that stuff, but he's been coughing every night for the last 2 weeks, and he didn't cough at all last night." And I mean, I didn't know he'd been coughing at night. So it really does help with that sort of thing. Decongest airways, helps to open up airways. You can put a couple of drops in a hot shower to open up your airways, or in a hot bowl of water with a towel over you. If you're going into a place, which we're not doing now, but that if you're very allergic to animals and you're going to go and visit someone who's got the animals, you can put a little bit under your nose. It helps with that, opening up airways. So we can make this chest mix now with this and with frankincense. And also oregano is very powerful for opening up airways as well, and helping with that respiratory, that sort of phlegm that sits in our lungs. So those are quite good combinations at this time. And this is the one that when Dom taught a class for some of my ladies who'd done feminine wisdom, and then they'd come back and they said, it's amazing. Our little girl didn't have to use her asthma inhaler for her hockey game, and she normally has to have her asthma inhaler, but we use the breathe oil and she didn't need to use it. And it's that sort of thing that's heartwarming to hear. And then finally, On Guard, which is our protective blend, which if you open this and smell this, it smells like Christmas. It's amazing. I just love it. It's got cinnamon and clove and citrus oils in it. This, so my sanitizing spray. I haven't used any of these hand sanitizers that are in shops. We just do 15 drops of On Guard, a little bit of coconut oil, and then the rest water. And that I use as a spray. I spray our hands, I spray my steering wheel, I spray the trolleys. You can make an alcohol-based one with a purer alcohol and put half alcohol, half water. So that I keep more for trolleys or if I'm out and about. But the one with plain water is really nice because I can use that to spray. I can spray it in my mouth. This you can definitely ingest. At the first sign of me feeling sick, I'll put a drop under my tongue and drink a little bit of water. Again, it's in my little kit here, my On Guard, and the kids all have ones next to their beds. So again, first sign of any sickness, we put it around our glands, put it under feet. I would wake the children by putting, well, now they do it themselves, but we put it under feet and on hands, particularly going to school and things. And so it's a protective blend. It protects our bodies, stops us, it's very strongly antiviral and antibacterial, so it stops us picking up stuff, but it also boosts our immune system. So we put that on a lot. If anyone sneezes, anyone coughs, they get Breathe and On Guard on them. And yeah, I've loved that. So even before this whole corona outbreak, when we were traveling, I did a spray bottle with sort of 10 to 15 drops On Guard, and then 5 drops of lemon and 1 to 2 drops of Melaleuca. And that's a really strong antiviral spray. So I would spray it around the plane seats on the which everyone thought was quite mad a few months ago. And now it's like the least, like now you would think that that wasn't enough. But spraying in, you can spray it in your mouth for that sore throat when traveling. So if anyone, I've got the throat spray, and if anyone gets a sore throat, we spray that. So these are the sort of tools that we have immediately available at our disposal. So the On Guard is immune support, non-toxic cleaner. So again, because it's so powerfully antiviral, so like we're doing for our hands and for surfaces, and for oral health. It's very good if you've got abscesses or again, cold sores, anything going on in the mouth. We make a little bit of mouthwash that's got 10 drops of peppermint and 5 of On Guard, but you could actually up the On Guard now, and then like 1 of Melaleuca, and we just rinse, and the kids all have their own too, and it's got a little bit of coconut oil and mostly water, and they just rinse their mouths after brushing their teeth. So with that, so those are the main oils. And then with this sort of combination, I'm just going to show you this one. We've got frankincense, lemon, On Guard, oregano, and Melaleuca. And those 5 together we use, and we make something called Flume. So this is my Flume roller. I actually just topped it up today because I used it for everyone yesterday and earlier. So this is your hugely powerful immune bomb. Like this, we do 5 drops of the frankincense and then 10 of all the others, but only 5 of the oregano. You could actually increase the oregano if you really wanted to. But this is what we use when people are sick. So the On Guard is more protective. We use that to avoid getting what's going around it, or if we're just starting to get sick or a bit of a scratchy throat. But when I start to think that it's something more, that's when we use our Flume, our bigger guns. So we put that under the feet. We can put it up and down the spine. It smells very oregano-y. You smell a bit like pizza, so it's not something that you want to wear all the time on you. But again, sore throats, we put it there, can put it down the back of the neck. If it's evening and someone's getting a temperature or getting sick, then I'll get them to lie on their stomach, and we actually layer it. So we put like a drop of frankincense and rub it up the spine. Then I put a little bit of coconut oil, rub it up the spine, and then we'll layer it, putting a drop of each of these up the spine, and then putting a little warm blanket and sort of keeping them warm and or going to sleep. But then this is more for quick, like, okay, well, let's quickly do this. We don't have time to do that whole routine. So this is more for easy access. And we send all these recipes and we show you little videos of how to do it. So it's not, because this is a lot to take in and there's a lot to remember. And it's, yeah, so we help you through this, because it's, otherwise we'd all have to be aromatherapists and have to have degrees in aromatherapy to remember and to use our oils properly. So that's the basic starter kit. Let me just tell you. So if, like me, you know that this resonates with you and it's something that you would want to get into your homes straight away. So I'm just looking for that. Here. There are 2 different starter kits that one can get. There's the smaller bottles, which is the family essential kit. This is the top 10 oils. This is 2,940 Rand plus 75 Rand courier fee. So they bundle all the oils together. Something like frankincense on its own is 1,200 in the bigger bottle, and lemons 200 Rand, 250 Rand. And they bundle it together, and so it's a better value. So that's this kit, which has got 85 drops in each, and it comes with a oil called Smart and Sassy. In the US it's called Slim and Sassy, but here it's called Smart and Sassy. It's actually a metabolic blend. It's got a lot of the citrus oils in it. It's very good for helping with cravings, helping with increasing our metabolism. It helps a lot of women postpartum when they're feeling like they just can't shift their, like 9 months down the line, and they can't shift their weight gain from pregnancy. It just also helps. I know Brains, who's on this call, loves it. She found that she had an injury and wasn't training, and she found that this was really helpful for her. So that's as a gift with that. And actually, doTERRA announced yesterday that this kit will now also come with an extra gift, which they're calling a sharing gift, of lavender, peppermint, and lemon. So you'll get that whole kit that I've just described for 2,940, plus a little trio of these, that the idea is that you share with someone. You can give to someone else if you want to, but otherwise it's obviously you can keep for yourself. So it's an incredible offer at the moment. So that's the 3. If, like me, you just know that this is what really resonates, is the bigger kit, which is the 250 ml bottles. So this is 4,495 Rand, but it comes with 3 times the amount of oil, and it actually comes with a diffuser, which is, it's a much nicer diffuser than this one, and which is worth 700 Rand itself. So when you take the costs of the oils and add the diffuser, you're actually only paying 700 Rand more for 3 times the amount of oils. I haven't explained that very well. Anyway, and that also comes with a little starter pack of the lemon, peppermint, and lavender as well, just as a gift at the moment. So I think that covers all of those. There is one more oil that I do just tell people about more now, because this, as I said, covers 90% of things. This is a little bit like a medicine chest. So if you went to go and see your GP and you say, I've got headaches, and he says, take a Panado, and then it doesn't help, then you'd say, well, what else could I take? And then you'd say, well, maybe take a Microdol. So it's the same with this. Like, if you can't sleep, lavender is really helpful. If it's a bigger issue than that, then lavender and frankincense is more powerful. If you're a chronic insomniac, then there's another oil that's called Serenity, which is even more helpful for sleep. So there's different steps, but this top 10 kit should cover almost everything. But there's this Copaiba, which is there was a lot in Utah about all the science behind this. This is from trees in Brazil, Copaiba trees. It's their equivalent of CBD oil, but it's an endocannabinoid, and it's very fast acting because it acts directly on our receptors. So it's a very powerful oil at decreasing our heightened immune response and bringing our body back to homeostasis. So it's very good for any autoimmune stuff, for arthritis, for chronic gut issues, and for anxiety. So that I also take a drop of in the morning under my tongue and in the evening under my tongue. And it really helps to take the edge off things and helps one's body's natural to work at homeostasis, to work at where it works best instead of at like a heightened immune response. So it's also a good one for boosting our system at this time. So that's just to tell you, it doesn't come in the top 10 pack, but because people who really struggle with arthritis or chronic immune stuff, that is a good oil to have. So are there any questions? Yes, Margie. Oh, you turned off your thing. Let me unmute you, Jill. I'll do it. There we go. Hold on. But there we go.
Thanks, Nicola. This has been really interesting. Nicola, what would I use in a diffuser in my office after I've had couples during the day and I want to just clear everything out?
Nice,
and
yeah. That's such a nice thing to think about. So I would probably put peppermint and lemon, particularly the lemon, because it's such a, it draws and detoxes and cleanses. The peppermint sort of uplifts, but you can also, like, my mum's a psychologist and she was still practicing up until up till mid of last week, and so she had her diffuser going with On Guard going because of helping to boost her own immune system.
Okay.
So if it was a time like that and you were feeling a little bit under the weather or something like that, or you had lots of patients who are under the weather, you'd probably put 3 drops On Guard and 3 drops Breathe, and that's more of a immune and opening up the airways. If it was but if it was more like just cleansing, then it would be more lemon and peppermint. I would put those on.
Thank you.
And then things like lavender and frankincense are more soothing and calming and for sleep. Or I gave it to one of the teachers to use in her classroom with a very busy class.
How long do the oils last for?
They last so long. They all have expiry dates under them because they have to, because of the purity, but it's similar to like olive oil. So if you keep it in a dark, like in the dark container and outside of the light, it shouldn't denature. You don't want it in heat and sunlight. But like when it's a little bit, when we have it in roller bottles like this, if it's in the light and out and about, this would probably only last 3 or 4 months, but you start to just smell, it doesn't smell as strong or as potent, or and then so you could swap that. But I use them so often that I haven't got to that experience. But these will last probably for years.
Okay. And in the kit, does it come with a little roller and some of the droppers and some
what
of
we do as a gift is what, and this we'll just have to, once we know about the shipping. So doTERRA have had shipping on hold, but we're hoping that it's going to be shipping. They're going to be resuming shipping. We had a positive news yesterday, and so we should know more today. But we give a gift to people who enroll through us of fractionated coconut oil, which is a bottle of that, empty spray bottles, rollers, a couple of rollers, a spray bottle, little sample bottles, and the pipette, and this little information thing on how to use it so that you can get yourself going straight away. And then we get all these at cost. Like this is like R6.50. The rollers are sort of R5.50. So it's quite cheap and easy to make these. And something I forgot to actually mention is, as a special, but this is very late in the day because our team has been running this for the month end, we are offering a peppermint touch. So it's like a peppermint roller, but it's a doTERRA one. So they're beautifully branded and a lovely dilution. So that for headaches, for neck tension, but this is for people who enroll before the end of the month, which is the end of tonight. So it's quite late in the day, obviously, for this class to know about, but that's just a little extra like gift.
Thanks.
Anything else? So I think everyone on the call, Karen, Brenda or I invited, actually, no, so you speak to whoever invited you to the call, and they'll give you a link on how to order if you're wanting to order. And usually the shipping is 2 to 3 days, which is amazing, and 75 Rand. And then once you have bought a kit, you can then buy any of the other oils at a wholesale price, which is a 25% discount, as opposed to their retail price, which is obviously the retail 25% more.
Is that all the enrollment involves?
Yes. Yeah. So you don't have to buy anything per month. You're not committed to anything. People who land up buying a lot of oils regularly, they do have a loyalty rewards program that's very generous, that gets you back your points on shipping and gets you back points on your oils, but it's entirely free to opt in and out of, and it's not something that you do when you first sign up. First, you sign up and see if you love your oils and use your oils, and if you then finding you're ordering more, then it's worth looking at. But yeah, there's no commitment to do anything else.
Okay, thanks.
So, yeah.
That was great, Nikki. Thanks. Lots of information.
Pleasure, Karen. Well, it's a lot to tell and a lot to but I'm so passionate about them, and we send resources to support people afterwards, because the last thing we want is for people to buy a kit and then it just sits in your drawer and you don't use it, or you don't have confidence to know how to do it. So it really does work on educating and empowering and sharing. And we have a WhatsApp group that we put people on. It's only on the oils, and people can ask questions like, what do I do about this, or where do I get this, and then everyone can learn from that.
That'll be great.
So I did actually another talk at a physio practice recently, and I just, as physios, I think it's just something that's a powerful tool for ourselves, and we can all think of patients who would benefit from it, and empowering people to look after their own health and wellness.
Yeah.
So I look forward to chatting to you more.
Yes, let's, when this lockdown's over, maybe we can get together.
Yeah, definitely. But I'd love to hear more also about your women's health stuff.
Thanks. Yeah, that'll be good.
Cool. Thank you.
I'm going to sign out. Thank you.
Perfect. We'll be in touch then. Thanks, Karen.
Thank you.
Anything else?
Thanks, Nex. That was a great class.
Thanks, Brens. Thank you very much. Nice
Chat
to
to
see
you tomorrow.
Did John T. Carroll listen?
No, he's putting kids to bed.
Okay.
Send me the recording, see.
Oh, yes, I forgot I was recording. Let me just pause it.
Yeah, I think you were. Maybe,
Yeah.
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 Okay.